and active in GBAO for 12. I'm an architect in practice in Boston for over 40 years, and a principal in an architecture and planning firm called Miller Dyer Spears. It's a small business with about 40 employees. I'd like to give you a view of the challenge we've faced providing healthcare insurance for our staff over the past decade. As a business owner, I know that it is essential to provide healthcare insurance coverage for our employees. I believe it is a human right, but the sense of security for our employees is also good for business. For the past 10 years, we faced annual notification of substantial increases in premiums to continue our healthcare coverage in the range of 10 to 25% per year. Every year we had to search among alternative plans, levels of coverage, and insurance providers to find coverage that the firm and the staff could afford. The result has been a continued erosion of coverage benefits to maintain affordable premiums. To illustrate, in 2003, we had an HMO plan with a $10 copay per office visit and hospital admissions fully covered with no copay. Over the years, we've had to shift to an HMO plan, which now charges $25 copay per office visit and $1,000 copay per hospital admission. And still, the monthly premium for a family has almost doubled from $875 a month to $1,675. In 2008, we were hit with a proposed 24% increase in premiums, so we decided to add a second option, a deductible plan, which had lower premiums, but makes the employee pay upfront $1,000 of healthcare costs, or $2,000 for a family. This deductible approach is actually preferred by a majority of our employees due to the lower premiums. However, the deductibles have since doubled to $2,000 for an individual and $4,000 for a family. And even so, the monthly premium for family has increased from $1,020 to $1,320. Our firm shares the cost of the healthcare coverage with the employees, paying 60% of the insurance premiums and the majority of the deductible amounts. For our business, the effect of these changes has been dramatic. Our firm's overall healthcare expenditure has almost tripled over 10 years, going from $70,000 in 2003 to almost $200,000 this year, despite insuring 15% fewer employees. The firm's out-of-pocket healthcare costs per employee has gone from $2,060 to almost $6,900. Yet in this time, the company's income, or net earnings, have remained essentially flat. The profitability has been severely squeezed. The net effect of these rising healthcare costs is that the firm has fewer resources available to increase employee salaries and bonuses. We're worried for the future. Our benefits advisor expects continued escalation in healthcare costs with potential double-digit inflation each year to cover Affordable Care Act plus healthcare provider cost increases. While we're committed to offering good coverage and supporting our employees' needs, we've reached the limit of our ability to fund the benefits. If costs continue to rise, we fear we will have again to manipulate the plans, shaving the quality of coverage with higher copays and deductibles, and increased cost-sharing burden on our staff, and with further impacts on the profitability and viability of our firm. That is why we are so concerned about the results of this cost containment initiative.